So there I was, belly shaved.
Yeah, been there. Undignified, isn't it?
I know exactly what you mean. Right, well, until next time.
Oh.
Smell you later.
Bye.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Here she is, the puppy with the best haircut in town.
Just make sure you're not swollen under there.
Known as a nation of animal lovers, the UK is home to 36 million household pets, 12.5 million cats, 13.5 million dogs, and not to mention all the other creatures, great and small, that we welcome into our families.
And in this new series, we'll be finding out what happens when our fur-legged friends are in need.
I'll meet their devoted owners and the expert staff who treat them. From the routine...
Emergency Ward 10, I'm your girl.
...to the life-saving, and everything else in between.
Oh, thank you very much.
We'll capture the intense bond between owners...
You're doing good, Baba.
Doing
well
really
done.
good.
animals, and the vets. And I step outside the clinic to see how complementary therapies go hand in hand with veterinary medicine.
It's a big commitment for you, Emily, to spend this much time on him. Yeah, he's worth it, though. That was the right answer. So, join me, Fern Britain, on a roller coaster of emotions inside the vets.
In the southwest, not far from Bristol city centre, is the residential suburb of Henlees. It's here that husband and wife team, Andy and Amy Valencia, run their veterinary clinic.
He's at the age where his weight will start to plateau a little bit.
Yeah.
Helping local pets and their owners have a healthy and happy life. Dr. James Greenwood, veterinary surgeon, also practices here.
Good girl. Very brave.
Together, the team have kindly invited me into their world, where I'll be assisting them with the extraordinary care that they give to their patients and their owners.
Oh, bless you. She's doing great.
As a nation of pet lovers, we rely heavily on the 35,000 veterinary surgeons across the country who dedicate their lives to our animals.
You okay?
Some of the most common issues facing pets are arthritis, ear infections, gum disease, and Boston Terrier dogs in particular are prone to eye problems. Like our first patient, Mara, who's here to see Vet James.
Mara, she seems such a lovely little girl. How old is she now?
So she's nearly 9 years old. She's actually a rescue, so the current owners, they love her with all their heart. She's turned up with a little bag of biscuits for us, which is very kind, but she's come with her own little crochet blanket, and she's in very, very good hands at home. So she's
You're a special lady, Mara.
really landed on her feet.
You're a special lady. Oh, thank you very much. She's thinking, where's my biscuits and where's my crochet blanket? That's what she's thinking.
She came in to see us a couple of weeks ago with a sore eye. We did a check of the eye, made sure that there was nothing structurally that was the matter with it. But what we found was an ulcer on the surface of the eye. Ulcers in dogs are really, really painful. So they can unfortunately be quite tricky to treat. So we always start with using some eye drops, obviously, some lubricants, some antibiotics to try and get on top of it. But unfortunately, with Mara, those first drops haven't quite got on top of the ulcer, so it is still there. So the top layer of the eye isn't sticking down to the eyeball as we'd expect it to.
This is the drop staining, I guess, is
That's
it?
right, yeah. So that's from
darling.
last week where we put some stain into there.
So the eyes are generally slightly bulbous on this sort of terrier. Does that lend itself to these sort of complications with eyes and nose?
So sadly, yes, it does, yeah. So these breeds, they are obviously unbelievably cute, and often their personalities are very gentle. But sadly, because of the shape of the face, which is after human breeding over many, many years, they are now suffering with quite a few health conditions themselves. They have these big bulgy eyes, like you say. That means that the eyelids don't always properly close over the eyes, and that can predispose them to these types of ulcers. So first thing I need to do is put some stain into the eye so that we can see where the ulcer is. But that stain can sometimes go all over the place. So I am going to suggest with your lovely cream jumper that we might pop an apron on if you're happy to.
Thank you for your thoughtfulness.
That's no worries at all.
I'll be back. Hang on. Oh, lovely. Right, you ready for this, darling? Here we go.
Good, right, I don't feel quite so responsible now. This doesn't hurt, this drop, at all, but she has had 2 weeks of drops going into quite a sore eye, so she is a little bit sort of primed and maybe a bit nervous about having drops put in. So what we'll do, we'll go nice and steady. If you can just have a really good hold over her shoulders.
Does that look like I've got a
That
good
looks great.
firm- Okay.
That looks great.
It's not going to hurt. It just is a shock.
Not gonna hurt.
These are the bits where you worry because you don't want them to be hurt. Have you done it?
Done.
There. Well done, darling. And now you'll be able to see
now-
better in there, will you?
Yeah, you can see that big green
Yes.
splodge on the surface of her eye.
Yes.
So that is the actual ulcer itself.
Oh, it's big.
Yeah, yeah, and you can almost see around the edge of the ulcer, there's kind of almost like a wall, and that's what we call underrunning. So the edge of the ulcer has now sort of almost got a little bit of cornea that's underrun, so it's never going to be able to heal from the outside in on its own unless we kind of peel that back a little bit first. So that's the job for today.
Gosh, that takes a lot of precision.
It's going to take a lot of precision, so we have to peel that ulcer right back to the healthy tissue underneath for that tissue to then be able to move forward and heal.
You've done very well there, girl. You've got a bit further to go, but we're on the right road. Going in the right direction.
Absolutely, absolutely.
Oh, Mark. Now I'm in love with her. She is lovely.
Almost 1 in 2 households have a furry, scaly or feathered friend, with 95% of owners considering them part of the family. And the most popular dog breed amongst families is the Labrador. They come in all shapes and sizes, and they're known for their big appetites. But this young Labrador is off his food, a clear sign to his owner, Guy, that all is not well.
Have we got Rusty? Hi.
Hello, James. How you doing? Nice to see you
good.
again.
You too. Come on in.
Thank you.
Let's have a little look.
Hello, Rusty. Hello, darling.
Despite his perky appearance, Rusty has recently been diagnosed with Addison's, a rare disease caused by insufficient levels of hormones made by the adrenal glands.
He's very handsome. And he's young.
He's only just over 2, yeah.
Unlike humans, our pets can't tell us what's wrong, so there's a lot of investigation work that vets need to do so that they can get to the root of the problem.
I think what would be quite good today is let's just check him over first.
Sure.
We'll just have a good check. We've weighed him outside. He's 27 kilos, so he has lost quite a significant amount of weight there as well. Right. So in the last, 5 or 6 days, he's lost about 3 kilograms.
What is it ringing bells in your head?
Well, so we know that he's got Addison's disease. I'm still convinced that that's the ultimate diagnosis of what we're trying to
And
what
this
we're
is
trying
an
to do.
autoimmune thing.
Yeah, of his glands, so he's not producing enough steroids. A healthy dog, when they're faced with stress, will produce 2 types of hormones. That helps the body to kind of cope with the stress, and it helps to regulate all the different body systems. That could be a trip to the kennels, it could be going on holiday. In Rusty's case, it was actually his owner's moving house. With Addison's disease, though, the body can't produce those types of hormones. So actually, when they're faced with stress, the body goes into crisis, and that's when we get the clinical signs of Addison's like we've seen with Rusty. Is he eating at all at home?
Very little, like sort of morsels, to be honest with you.
Okay. Drinking and weeing, is he drinking?
Yeah, we're making sure we're getting the water into him. He's drinking pretty well. Not like I would say, again, how I'd like him to be, really.
That hasn't gone up, though? He's not drinking more than you'd expect? That's good.
No.
Okay. And what's coming out the back end?
I did take a little picture for you of something that came out, if you would like to see it.
Do you know what? I would actually quite like to see that, weirdly. I would love to. Let's have a look. Oh, right. Okay.
Oh.
So that's...
Wet.
That's very wet, yeah.
Black
okay.
and unpleasant.
Yeah, that doesn't look great. The question is whether the treatment we've given him is sufficient, or whether we've almost got some side effects of some of the medications, which could then cause gastric ulceration. It could cause a bit of internal bleeding in terms of into the stomach, into the intestines. But more importantly, I'm just worried that he's not eating.
To rule out any other issues, James needs to do a full once-over.
Oh, look out.
Rusty.
This is a bit of a treat for you, darling.
Maybe take care of head end and I'll sort out what's happening back here.
Okay, no worries.
Thank you.
A dog's temperature is naturally higher than humans. A healthy range is between 38 to 39.2 degrees.
His temperature's 39.2, which is perhaps a little higher than we would otherwise expect.
Right.
Would that be a sign of infection with the
It could be.
temperature
It could
going up?
be. What I'd quite like to do today, if you're happy, would be to repeat his blood test, and then I think it would be a good idea to get him on a drip. I think he is still a bit dehydrated, especially what's coming out the back end.
Yeah.
So I think if we just give him another maybe day or two on fluids, that might just give him that last bit of boost before he actually manages to sort of correct himself a little bit further from that.
Fantastic, okay.
Good, right, let's get that sorted out.
Dehydration in dogs is potentially life-threatening.
Should we go this leg?
So Rusty will now go on a drip for an hour and be closely monitored by James and the team.
That's it, don't look rusty.
Stung by a bee. Don't judge me. It'll probably happen again.
Fern Britain Inside the Vets brought to you by Pet Plan Insurance.
Uh-oh. Vet bills. Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britain Inside the Vets brought to you by Pet Plan Insurance.
Girl. Top lady, aren't you?
Boston Terrier Mara is now sedated, ready for James to perform special eye surgery known as diamond burr debridement. He'll be assisted by veterinary nurse Ella and cheered on by me.
Fern, do you want to come around and have a look on this side? I'm just going to grab my scope.
glasses on.
Because what we can see, what I was trying to show you...
Oh, yes, I
under
can
the
see it.
aesthetic, can you just see there's almost
Bump.
the indentation into the eye there?
Yep, I can see that.
So the first job is to basically sterilise the eye. What we do is make up a dilute solution of iodine, and then...
Well, that would sting if you were awake, wouldn't it?
Exactly. And just do a
So this
little-
is before you make any kind of opening in the eye to make sure that no infection on the outside can get on the inside, is that right?
Exactly, exactly.
Yeah. Some people at home will be thinking, oh, I wouldn't put my doggy through that.
The difficulty is that if we didn't do this, then unfortunately the ulcer will only get deeper and deeper and deeper, and that can then risk the eye rupturing, and then you could potentially lose the eye altogether.
Okay.
Right, I'm pretty happy with that.
With the first stage complete, we can move into theatre.
Okay, right, let's go through.
Come on, Mara.
Here we go, little one.
We're not required to mask up for this procedure. Masks are, however, recommended for anything more than a skin incision in order to avoid infection.
Right, so the first job is to debride with a cotton bud. This bit is just about peeling back that top layer. So the dryness of the cotton wool at the tip of the cotton bud just helps to peel away.
Okay.
Without doing this, it's never going to heal, basically. So we just keep debriding back and back and back.
Just abrasive enough.
Exactly.
Okay. Oh, makes me feel a bit wobbly.
Yeah, it's quite intense, isn't it, when you see it. Trouble is, I go into vet mode, so I don't really think about what I'm doing.
The next step requires James to use a new bit of kit, which increases the chances of a more successful outcome.
This is our diamond burr, so we turn it on under here so you can see it suddenly starts rotating. There you go, can you see?
Yes.
So it's really subtle.
So like a jeweller's thing, this is it?
Yeah, it is a bit, isn't it?
Polishing diamonds.
Yeah. What's great about this technique is that in theory, 70 to 80% of these cases will resolve just with this one treatment.
Really?
So I'm really hoping that we'll get a good result.
Good. It's peeling away.
It's peeling all the way back there.
Good. Well, you've done brilliantly. Can I do anything else? Mop your head?
I'm going to say something along the lines of that.
This surgery takes 20 intense minutes, and precision is key.
Right, I'm going to try and get underneath this third eyelid now.
I might not look at this bit because I'm a bit worried about it.
So we're kind of, you know how you have to sand a wall before you paint it? It's a little bit like that. So we're trying to create tiny little micro scratches all over the surface of the eye to then give the drops somewhere to sort of grip into and hopefully do their job to help heal the eye up as quick as possible.
Yes.
So that's it. I'm happy.
Oh my goodness. Do you know what? Watching that, it just... First of all, you're looking at dear Mara lying there, you know, vulnerable, fast asleep, which is the emotional part of it. And then the absolute pride to be standing next to someone like James with all his experience and all his knowledge is incredible. We just all need these fabulous vets, don't we? And let's not forget Ella, his nurse. So together, they've given Mara possibly a new lease of life.
Our 3 vets see more than 15 patients a day, and their job wouldn't be possible without the support of their 4 veterinary nurses. So I'm keen to know more about their role.
Today we have got both Ellas, 2 Ellas.
Yes.
Why did you want to be a veterinary nurse?
I always knew it was animals that I wanted to work with growing up. Where that would lead, I wasn't sure at the start, but soon it became quite clear that nursing was the path, because I just enjoy that nurturing and caring side of the patients that you get to do in this job.
Yes, tell me, what are your jobs?
Oh gosh, where do we start?
Nurses can do what's called like Schedule 3 procedures, so that's including like stitch-ups, so like small lump removals. So doing that as part of nursing is really interesting, so you're getting properly hands-on.
Day to day, we're running anaesthesias for surgeries happening. We're looking after the inpatients, like the hospital patients, laboratory work, dental procedures.
Do you get emotionally involved with the animals that do come in?
I would say so. I think in order to do this job successfully, you have to, for me anyway, I know that being able to care is having that emotional connection to them and being able to do my job properly. It's important to have that separation as well.
I just love being involved in all of it. So similarly, making sure that you're looking after the patient, it's a good feeling, I think, working and knowing that you're doing a good thing.
The life expectancy of pets has generally increased over the last few decades, mainly due to the advances in veterinary care. On average, our domestic kitties roughly reach the ripe old age of 11, but now they're living longer than they used to. And 18-year-old Paws is a prime example.
Paws is just an absolute dream of a cat. He has got a big personality. He makes himself known, he's really affectionate, he's a total tart. He's definitely the boss in the house. Poor old Barney, his sister, has to defer to him. They were abandoned, and so we fostered them and their mother, Fern, at a week old. To be honest, Paws is a bit of a man's man, and if he had a choice, he would choose my husband's lap over mine. But any lap is better than no lap.
Precious Paws is certainly lapping up the attention. But this old fella was recently diagnosed with hyperthyroidism, a common disease in older cats caused by the overproduction of thyroid hormones.
Come on, Barney. Come up. I know.
Although Paws is taking meds for his thyroid, Bridget has noticed her feline friend has deteriorated and requires a checkup with James.
Here he is, little man. How have you been doing? How's he been getting on?
He definitely is not well.
Okay.
So he's not meowing anymore, whereas before he was calling out, he was really asking for food, asking for cuddles. Mm-hmm. And now he's just gone really, really quiet, and he's definitely still losing weight.
Okay.
Yeah, he's really not himself.
He's definitely not himself. Right, let's have a good look over him generally. And any vomiting or diarrhea? Or anything?
No, he's not vomiting anything.
He's not
and
vomiting.
I've no idea about diarrhea because he goes outside.
Okay, let's have a feel of his thyroid gland under here as well.
Okay, it's okay, sweetheart.
There you go, you can just feel it's a little bit enlarged there.
Typical thyroid symptoms are increased appetite and weight loss. And Paws meds should be helping to combat that.
His left kidney does feel a bit more irregular, which, feel alone, that's just a finding. I think what we would ideally do here would be to scan him, so to do an ultrasound scan, so that we can actually see physically what the shape of that kidney is and if there are any changes there. With his thyroid medication, does he take that quite well?
Oh, yeah.
Does he?
Because we've been giving him treats afterwards. So.
Okay. So he's like, yeah.
The Pavlov dogs thing.
Yeah.
So he's very happy to take it.
Great. So it's going to be a morning with us, Mr. Paws. One of the big things we want to rule out today would be some sort of cancerous process, whether there's some changes in that kidney that might explain why he's sort of suffering with the weight loss, why his appetite is a bit variable, or it could be potentially even a reaction to some of the medication that he's on. We need to kind of keep a bit of an open mind, get the scan done, see what we can find, and then kind of make decisions from there.
Bye-bye,
Okay.
Bye, lovely.
Coming up, I check in on Labrador Rusty.
He does look sorry for himself now, not bouncing as he was earlier.
And I explore the benefits of hydrotherapy for pets.
How much longer do you think you might be doing the hydrotherapy?
I think while she's still enjoying it and while we're still seeing improvements, then we'll stick with it. It's just like a big bath for her.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Stung by a bee. Don't judge me. It'll probably happen again.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Earlier today, we admitted lovable lab Rusty, who's been struggling to manage his newly diagnosed Addison's disease.
Here's little Rusty. Oh, hello. Here he comes.
Concerned he's off his food and dehydrated, James decided to put Rusty on a drip to try and rehydrate him.
He does look sorry for himself now, not bouncing as he was earlier.
No, he's still definitely a bit flat, but it's a good sign that he's a bit interested in what we've got here.
Hang on a minute.
Look.
The chef has prepared a little something for you.
Oh, there we go.
Is that nice? Oh.
This is
The dog
great
is eating
news.
a meal.
This is great news. So that one of the symptoms that we see with Addison's is that they do go off their food.
How common is Addison's in dogs?
Addison's is, honestly, it's actually quite rare. It's something that we look out for in lots of times. So Addison's is something that we, as vets, we've always got it on our radar because it can mask as so many other diseases. Lots of poorly dogs come in and you kind of have it on your list of possibilities. So quite often we'll test for Addison's, but nearly always it comes back not Addison's and it's something else going on. But in Rusty's case, it was interesting. He got the blood tests absolutely sort of diagnostic for Addison's disease.
So once you've got him stabilised, how do you treat that?
So we treat it with steroid tablets and an injection of something called Zycortal. And then hopefully, other than that, he should be able to live a good quality and full life.
He's a good boy though, isn't he?
Rusty has shown some signs of improvement, but James still has concerns which he wants to discuss with his owner, Guy.
Oh, hi, Guy. It's James from the vets. Hi, yeah, not too bad, not too bad. We've got some updates. He's been on fluids all day. The only thing that is still a little bit concerning is that he's had quite a bright red diarrhea, which would suggest that there's blood in there. I am a little bit worried about whether he's got either some gastric ulceration or something like that may be as a consequence of not eating for so long, or it might be a consequence of the steroid that he's had as the medication for the Addison's. And I think it's now a little bit of a judgment call whether we keep him on the fluids overnight. He would need to go up to the out-of-hours hospital, or the other option is whether we send him home.
You're the boss, but my instincts are that maybe he should go in overnight.
I think clinically that makes more sense rather than trying to rush him home.
Okay.
Let's stick with that.
James.
Okay?
Bye.
Bye.
As Rusty is now a critical case and needs close monitoring, he'll be heading off to an out-of-hours hospital where he'll be on a drip throughout the night.
Right, here we go. Here he is.
You look good for 18.
He does, doesn't he?
Pensioner Paws has a thyroid condition and has recently deteriorated. After a once-over, James discovered a possible issue with his kidneys, so this old chap needs a scan.
Let's give him, we'll just give him a couple of minutes and see if that makes him go a little bit drowsy.
Because of his age, just a small amount of anaesthetic is used to make him sleepy and to keep him still.
Right, let's have a little look. How are we doing? Is he... Oh, that's looking good. Hello. He's looking a little bit sleepy now, so that should mean that we can do this scan without causing too much distress. So we're going to use the scanner, very similar to like a human pregnancy scanner, to just have a look inside and come up with an image so we can physically see the shape and the architecture of his kidneys, of his bladder, of his liver, have a really good look around and just see if we can spot anything that might explain his symptoms. So that, I think, is his left, this is his left kidney here.
Straight away, James can see abnormalities in the kidney and calls in vet Amy for her opinion. She has a particular interest and a wealth of experience in ultrasonography.
Yeah, it's definitely an abnormal kidney.
It's not looking lovely, is it?
His right kidney was 4.2, and then the abnormal left kidney was 4.7. This is just completely abnormal.
It doesn't necessarily look cancerous, though, does it? It doesn't look like we've got a growth on there as such.
No.
It's just the whole kidney looks enlarged
Abnormal.
and just...
I think to know anything more about that kidney, you need to take kidney biopsies and things, which would mean an anaesthetic, and it's quite a big undertaking for an older cat. I think his owners are a little bit more focused on making sure he's comfortable and feeling well, rather than necessarily having an absolute diagnosis.
We've done the ultrasound scan on Paws, and we know that there are definitely changes in that left kidney, which is much bigger than it should be, and all of the internal structures of the kidney are kind of sort of unrecognisable. So what we're going to do is just play about with his thyroid medication a little bit, because I think it could well be that the dose of his medication is causing a few side effects, so we might be able to make him feel a little bit better as well. I think we can be sort of cautiously optimistic. At least I haven't found anything really serious today, so I think we can say that's pretty good news. Right, should we get you home?
A little snooze all afternoon.
It's gonna have a lovely
It's gonna
afternoon.
love
I think it's a curl up and watch some nice movies afternoon, isn't it? Hey?
Perfect to me.
Yeah, absolutely.
The vets here have more than 50 years of experience between them, from surgical techniques to routine checkups. But alongside conventional care, vets can also recommend complementary therapies.
I'm really surprised, well, I don't know why I'm surprised, that there is so much room now for complementary medicine for animals rather than the conventional, modern, scientific medicines.
Yeah, and it's growing all the time, and I think that's, you know, as a vet, I think that's fantastic. I think anything that we can do to approach our pet's health from a holistic point of view, whether that's nutrition or it's complementary therapies, wherever we are with it, I think we have to embrace that, because, you know, if we can find ways to reduce how many drugs we're having to give animals, or we can improve their quality of life, then we absolutely should embrace that with open arms, I think.
And the evidence is clearly there.
Yeah, and that's what's great, is that actually, as these things do become more popular and more people do opt to use them, it means that we get much more data, and data is power. It adds to that snowball effect to say, look, let's take this seriously.
That's very good, isn't
Yeah.
it? And it saves a bit of money, I suppose, on other more invasive things that you might, as a vet, have to do.
Yeah, absolutely. And I think, you know, not only can it save money on surgeries, but also if that reduces how many medications we're having to use, especially maybe for older pets where the side effects of certain pain relief medication, for example, might mean we can't use as much as we might like to keep them comfortable. Using other forms of therapy to just bring those pain levels down a bit can really, really help.
I'm I'm intrigued to learn more about complementary therapies, so I'm stepping outside the vets to see how they can help.
One area that's growing in popularity is hydrotherapy. There are about 152 centres like this around the UK, and they can help osteoarthritis, orthopaedic conditions, soft tissue injury, and even weight loss.
Qualified veterinary nurse George Plummer started her hydrotherapy clinic 7 years ago on her family's farmland.
So how have you come from veterinary nurse to hydrotherapy expert?
Yeah, well, I used to work at a referral hospital, and there they had their own rehab centre, and it's just been a passion of mine, and just it took off from there.
And what kind of things can you treat here?
Everything from sort of arthritis to elbow and hip dysplasia, spinal surgeries. We see dogs, we see cats.
Cats in the water?
Yes.
They cope with that?
Yes, yeah.
That's extraordinary, isn't it? And this is expensive, so is this coverable under insurance?
Most insurance companies will cover this under complementary therapy on their insurance policy. We always ask owners to check with their provider just to make sure that it is covered.
George's first patient today is 8-year-old Spud and his owner Emily.
Hello, how are you?
Hello, good, thank you.
Good. How's he been?
He's been really good.
Good.
Yeah.
Any problems?
No, fine since last time.
Spud was diagnosed with elbow dysplasia when he was 2. The condition results in arthritis in later life, so Spud has been attending 30-minute hydrotherapy sessions to help alleviate his symptoms.
Here we go. He's trying to figure out how to get it without getting in. Is that yeah.
To tempt Spud into the pool, George is armed with a special doggy treat.
Good boy. Yes. I know. That's fine. That's fine. When you're ready.
This is special dog peanut butter.
This is peanut. Yeah, peanut.
Peanut. Excellent.
So the best way to manage sort of elbow dysplasia and arthritis is to keep dog's weight lower, just so it helps with less pressure on the joints. So when we're using the peanut butter for him, we're using very small amounts, just so that he's got enough just to lick and keep him interested, but not enough to put the pounds on.
Yeah, exactly, because it's this high density calories, isn't it? But also good for him, natural oils and things.
Absolutely. Good boy, you coming down? Well done.
How warm is the water there, George?
It is 30 degrees, so it's nice and warm. It's very therapeutic, but it helps with pain relief. Being nice warm water, so it opens up blood vessels, it relaxes the muscle, and it's really good at getting fluid to the joints when they start moving around in here as well.
Does this jacket have a buoyancy aid in it?
Yeah, so this is a life jacket, which just helps give him a little bit more buoyancy. He does like to get in and out.
Don't shake on me. Nice.
When you're ready.
This treatment can be life-changing for pets. 50% of older dogs will get arthritis due to wear and tear, so doing non-weight-bearing exercises can really help.
He was limping quite badly when we started, and his limp is gone at the moment. So I think he's just more comfortable.
You can see the difference.
Yeah.
He's swimming really well. How does it build up through the session, George, for what he's doing?
As he progresses, we'll increase the time that he swims, so how long he's swimming for.
It's a big commitment for you, Emily, to spend this much time on him.
Yeah, he's worth it, though.
That was the right answer.
Yeah.
Are you insured for all of this?
Yes, we're insured with Pet Plan. This is part of that.
Thank you, I'm loving that.
George's next patient is a rescue, a French bulldog called Boo.
Hello, how are we doing?
Good, yeah, you?
Hi, Boo. Hi, gorgeous. Right then, madam, let's go get you dressed.
Yeah.
Come on then, off we go.
Sadly, Boo was left paralysed after a risky spinal operation to fix her slipped disc. So to get her body moving again, she's having underwater treadmill sessions.
Okay, we're going to just start when you're ready. Well done.
Encouraging Boo every step of the way, are her family, Esther, Donna, and their son, Theo.
You're doing good, Baba.
Doing
well
really
done.
good.
There was a fear that Boo may have to spend the rest of her life in wheels, but the treadmill targets specific limbs and muscle groups, and 9 sessions in, Boo is doing well.
She has got quite a lot of high tone in that leg.
Yeah.
So, yeah.
So what do you think it is? Is just the muscles contracting just too tight now?
Absolutely. I just think she's just trying to use it a lot more to try and help herself up. So she's just tensing it a lot more. Just giving it a little bit of a rub can help with just breaking up that nerve pathway.
Yeah.
Boo has 2 sessions a week, but the length of treatment all depends on your pet's medical condition.
Gosh, when you stand here watching this, Donna, what a journey you have been on when you didn't think you'd ever see her standing or walking.
No, it's been an incredible journey in such a short space of time. Only been 14 weeks from operation, and there was nothing, no movement in her back end. So now she can walk, she can run along the beach as she did last week.
Wow. What does she like doing?
She loves sleeping. She loves eating cheese. But as long as she's being cuddled and in a warm blanket, she's happy.
And how much longer do you think you might be doing the hydrotherapy?
I think while she's still enjoying it and while we're still seeing improvements, then we'll stick with it. It's just like a big bath for her.
And it means so much to you as a family.
Oh, absolutely. You don't see them as a pet. They become one of your own, and you look after them as you would any other person in the family. She's
can see
living the
that.
most pampered life a dog could have.
Good girl. Good girl.
When we're standing here watching little Boo, who maybe, you know, a couple of decades ago would have had no proper future, and here she is, everyone's gone the extra mile for her, and she's living her very finest life. And this whole bond between humans and their pets is very real.
Coming up, a pretty Pomeranian is waiting to be spayed.
She's a bit annoyed because she hasn't had her breakfast.
And Mara returns for her post-op checkup.
May I just say, Mara, your outfit is adorable.
Uh-oh. Vet bills? Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
It's been 4 days since 9-year-old Boston Terrier Mara underwent a procedure to treat a painful ulcer in her eye.
Oh, hello, darling.
She's now back to see James for her post-op checkup and a chance for me to have another cuddle.
May I just say, Mara, your outfit is adorable. That pink suits the inside of your ears, and this lovely lead, very coordinating. Look at that. Oh, and by the way, if there's any problem, I have what you ordered, a tube of liver paste.
So I'm hoping today to just have a good look and see kind of how we're progressing, and then restain the eye and see if that ulcer has actually healed.
Okay, that would be amazing, wouldn't it?
Would be great. Okay, if you're happy to have just maybe a little cuddle with her there, I'll get
Definitely.
a
Mara is the most cuddly dog. How's it going? All right? Can you see a bit better?
I'm going to come around the front here so I can see her. If you'd like to employ paste. Okay, right, let's see if she'll let me.
Let's keep going. Good
Beautiful.
girl.
There we
done,
go.
lady. Just give me that liver paste. I'll tell you what, give me that liver paste. I didn't know you spoke like that. Mara, surprising.
Right, let me have a little look here. I'm going to turn the lights off a second, if that's okay.
Mm-hmm.
Right, let's see. Have we got any ulceration on the eye still?
Let's have a look.
Great. Okay, so there is still an ulcer there, but things are definitely going in the right direction. So we'll continue the drops as we are doing, and then I'll see her back in 10 days' time.
Oh, isn't that great? You just want to she just wants to finish this tube and then she'll be going home. I can't have too much, mate. There you go. Good girl. Good girl.
The next patient to check in is pretty Pomeranian Zena.
Good morning. You got Zena?
Zena Moreira, yes.
Lovely. If you want to take a seat, I'll let the admit nurse know you're here.
Okay, thank you.
Thank you.
This fluffy breed was once popular with Queen Victoria. Her Majesty even showed them at Crufts in 1891, although they were much bigger dogs back then. Zena's mum, Paula, also has a passion for these pooches.
I have 5 plus Zena. I have them for a few years now. They're very good. They love people. They love cuddles. And they're small, easy to carry. And they're just beautiful as she is, as you can see.
5-year-old Zena is here to be spayed, a common procedure which can stop pregnancy plus reduce the risk of cancer and womb infections.
She is a little bit worried because there's a lot of people around. Also, she's a bit annoyed because she hasn't had her breakfast. Well, she's just a bit nervous.
Vet nurse Ella is overseeing Zena's appointment today. The right age to have your dog spayed all depends on its breed and size, so always check with your vet in advance.
She's been absolutely fine for the past couple of days. No worries, no concerns with her.
No,
No,
all
good.
fine.
And we're not worried that she's coming into season or anything. Or when was her season?
Now it should be, her season should be in March.
March.
Really.
Perfect. And any other questions before I pop her at the back and get her ready for the day?
No questions, but requests. When she's done, please do call me straight away.
As soon as she's out, we'll let you know. Yeah.
And then, we go from there.
Yeah, perfect. Lovely.
Bye,
Thanks,
Zena.
Paula. Have a
See you later.
Yeah. I'll give her cuddles. I'll look after her today.
Thank you.
All right, monkey.
Bye,
Okay.
Zena.
Thanks, Paula.
Thank you so much.
That's
Bye.
okay. Should have a quick check over. Let's just make sure you're not swollen under there. Okay, so that's a little bit big. There's a little bit of blood there. So we might actually be in season, even though it's supposed to be in March. You might have to have a chat to your mum.
To reduce the risk of complications, it's recommended that dogs wait a minimum of 2 to 3 months from the end of a season before they are spayed. So Zena will need to return at a later date for her procedure. It's been 2 weeks since 18-year-old Paws came to the clinic. Despite James discovering he had an enlarged kidney, they decided it was best to let him enjoy the rest of his retirement.
Since Paws has been to the vet, he disappeared for a few days and we didn't know where he was. We would see him every single day. He would definitely come in for cuddles, come in for food. So the fact that we hadn't seen him from Sunday afternoon to Tuesday was really worrying. We put out a flyer around the neighbourhood to see if people had seen him. I eventually found him hidden under a double bed in the spare room in the very, very far corner behind a whole load of boxes. It felt really good to get him back because I am worried about him and I do feel as though he is coming to the end of his life and I would really like him to feel safe and cared for and loved when that time comes.
Come on, Paws.
Paws has just been truly loved in the heart of our family. He's a real character. Yeah, he's been a real joy.
Ten days after his last appointment, Labrador Rusty is bounding up the road with his owner, Guy. He's ready for his checkup.
Hello.
Hello
Hi.
again.
How are you
Nice to see you.
doing? Nice to see you. Look
Very
at
good.
you.
Back to
Oh my
normal. Amazing
Look
recovery,
at you.
yeah.
This is the Rusty we know and love, isn't it?
Absolutely, yeah.
How's he doing? So I got some treats.
Really, really good.
So how's it been the last few days?
Fantastic, like back to normal. with a vengeance, yeah.
Good.
As you can see.
I was going to say, he's eating these treats very well.
Yeah, he's now eating like a lord, chicken and ham and goodness knows what.
Yeah, what's coming out the back end, is that nice?
Normal, yeah,
Good.
absolutely. Yeah, it's
great. Well, this is all music to my ears. This is exactly what we kind of hope after a week or so after that first injection. So today's plan, I'd quite like to get him weighed and just see if we put a bit of weight back on, and then I'll also get his blood test, and then depending on that blood test, that'll determine what dose we give him of his next injection.
Fantastic.
Okay. Good. Right. Should we get you on the scales, mister? Hey, let me grab a treat.
To keep his Addison's disease under control, Rusty will need regular checkups and he'll be on medication for the rest of his life.
Okay, Rusty, you ready? Let's go. Here we go. Yay! There we go. He's looking so bright. He's just looking fab, so I'm really, really happy. And then we'll see you back then for his day 28 injection after that first injection.
Wonderful.
Yeah,
Brilliant.
sounds good.
James.
Yeah, no worries at all. So we'll see you next time.
All right, all the best. Cheers.
Bye.
Bye.
Sadly, shortly after filming, Paws passed away. And like owner Bridget said, he was a real character until the end and will be sorely missed by his family. Next time, inside the vets, I scrub up for surgery.
Kidneys over there, hiding under the liver.
Wow, what a piece of kit that is. And we meet the rescue hounds who've been given a second chance at life.
She looked up at me from the kennel and I felt really affected by it.
The rescue story is so beautiful. That journey and that relationship can just be so special.
It's gonna be okay, Mum.
Fern Britain Inside the Vets, brought to you by Pet Plan.
Lights are flashing through the night. We're stepping into something bright. Skyline dances with the dawn till the past is gone, gone, gone. Street filled with a neon glow. We're ready for the future show. Echoes of the city's cheer, bringing in a brand new year. With fireworks and sweet champagne, we're dancing in the midnight rain. Let's toast to dreams that bring us near, bringing in a brand new year. Time is racing, can't stand still. We're chasing down that next big thrill. Voices rise.
Okay, so that's a little bit big. There's a little bit of blood there. So we might actually be in season, even though it's supposed to be in March. You might have to have a chat to your mum.
To reduce the risk of complications, it's recommended that dogs wait a minimum of 2 to 3 months from the end of a season before they are spayed. So Zena will need to return at a later date for her procedure. It's been 2 weeks since 18-year-old Paws came to the clinic. Despite James discovering he had an enlarged kidney, they decided it was best to let him enjoy the rest of his retirement.
Since Paws has been to the vet, he disappeared. for a few days, and we didn't know where he was. We would see him every single day. He would definitely come in for cuddles, come in for food. So the fact that we hadn't seen him from Sunday afternoon to Tuesday was really worrying. We put out a flyer around the neighbourhood to see if people had seen him. I eventually found him hidden under a double bed in the spare room in the very, very far corner behind a whole load of boxes. It felt really good to get him back because I am worried about him and I do feel as though he is coming to the end of his life, and I would really like him to feel safe and cared for and loved when that time comes.
Come on, Paws.
Paws has just been truly loved in the heart of our family. He's a real character. Yeah, he's been a real joy.
Ten days after his last appointment, Labrador Rusty is bounding up the road with his owner, Guy. He's ready for his checkup.
Hello.
Hello
Hi.
again.
How are you
Nice to see you.
doing? Nice to see you. Look
Very
at
good.
you.
Back to
Oh my
normal. Amazing
Look
recovery,
at you.
yeah.
This is the Rusty we know and love, isn't it?
Absolutely, yeah.
How's he doing? So I got some treats.
Really, really good.
So how's it been the last few days?
Fantastic, like back to normal. With a vengeance, yeah.
Good.
As you can see.
I was going to say, he's eating these treats very well.
Yeah, he's now eating like a lord, chicken and ham and goodness knows what.
Yeah, what's coming out the back end, is that nice?
Normal, yeah,
Good.
absolutely. Yeah, it's
Great. Well, this is all music to my ears. This is exactly what we kind of hope after a week or so after that first injection. So today's plan, I'd quite like to get him weighed and just see if we put a bit of weight back on. Sure. And then I'll also get his blood test. And then depending on that blood test, that'll determine what dose we give him of his next injection.
Fantastic.
Okay. Good. Right. Should we get you on the scales, mister? Hey? Let me grab a treat.
To keep his Addison's disease under control, Rusty will need regular checkups and he'll be on medication for the rest of his life.
Okay, Rusty, you ready? Let's go. Here we go. Yay! There we go. He's looking so bright. He's just looking fab, so I'm really, really happy. And then we'll see you back then for his day 28 injection after that first injection.
Wonderful.
Yeah,
Brilliant.
sounds good.
James.
Yeah, no worries at all. So we'll see you next time.
All right, all the best. Cheers.
Bye.
Bye.
Sadly, shortly after filming, Paws passed away. And like owner Bridget said, he was a real character until the end and will be sorely missed by his family. Next time, inside the vets, I scrub up for surgery.
Kidneys over there, hiding under the liver.
Wow, what a piece of kit that is. And we meet the rescue hounds who've been given a second chance at life.
She looked up at me from the kennel and I felt really affected by it.
The rescue story is so beautiful. That journey and that relationship can just be so special.
It's gonna be okay, Mum.
Fern Britain Inside the Vets, brought to you by Petplan.